Hello, my name's Joyce Gibb. Thank you so much for being with me today. Today I'd like to go over just a couple emails here, and these are very similar, and I'll just review those first of all. It says, "Hi Joyce, my husband, who is in his 60s, has been having some difficulty remembering certain things throughout the day. For example, he tried to give our dog the same meds he had already given her twice. We fear that, this may be signs of early onset dementia. His mother had dementia, and we are hoping for the best. We saw our doctor, and we had blood work done as well as a memory test. He did well on the day the test was given, and we were watching the results of that and actually looking for the blood work to come back. Unfortunately, my husband is a very heavy drinker. We are working on weaning him off alcohol. What can be done, what we can do now to slow this down, and is this indeed early signs of dementia?" It certainly does sound like they're early signs of dementia. When I was trained by Dale Bredesen 3+ years ago, about cognitive decline, there are 4 main categories that we look at. We look at inflammation, we look at high blood sugars, we look at infection, we look at low trophic factors. And one of the things that keeps coming up with a lot of patients is, what's alcohol? Alcohol, sugar. So there's many reasons that you have cognitive decline. It's usually not just one. And then you have to look at, is there Lyme disease? What's the chance of infection? Is there mold exposure, which is huge in this population of memory loss? So there are many reasons for that. We do a lot of labs and look at that. But I want to go over the next person too, because it's very similar. So it says, "Hello, Joyce. Over the past 2 weeks, our family has been navigating several unfortunate events. My mother was driving to work and got lost, and that's very common when you have cognitive decline. When she eventually arrived at work, but suffered more and more memory loss. She was taken to the hospital, and doctors found cysts on her brain. They operated successfully, but she is still experiencing memory loss. Thank God she's doing better and no longer in the neuro unit. What supplements could help her on her road to recovery and full memory and brain function? God bless." So you have to look at, why did she have cysts? I mean, nobody really knows officially why you have cysts in your body. You have cysts in your kidneys, you have cysts in your brain, you have cysts in your lungs, and basically, cysts in your uterus, and that's usually a response. It's an inflammatory response. Cysts usually develop just because there is something your body's trying to just engulf. So one of the things for both of these patients, your brain is made of 70% fat. First thing I would do is do a really good omega. Omega fish oil is good fat. Quercetin and turmeric actually help decrease inflammation. And, 450 milligrams twice a day is typically what we do with that. There's the other category is low trophic factors for both of these patients. Somebody that drinks a lot typically has low testosterone. Postmenopausal women, they have low estrogen and progesterone. So the main hormones in both of these categories of these people probably are potentially low. So low trophic factors are hormones, vitamin D, and thyroid. And as you've seen before, vitamin D plays a huge role in people with COVID as the anti-inflammatory response. So mold is a huge player and maybe in both of these people. So we have to evaluate mold exposure. You can do tests in the home. You can do a visual acuity test called VCS that you look on the computer to see if potentially you have mold exposure, and in addition to testing your home. Heavy metals and chemicals, all those things together. Lyme disease actually is a player in many of these things too. So I would be really happy to try to help you negotiate this path, this journey as to how you can, in addition to what conventional medicine is doing. And so just give me a call and I would love to help you through that. Take care. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.